Looking good. Thank you, Callie. Good morning, everyone. Good morning. My name is Carol DeAndres. Let's go to the next slide, please. There we go. Good morning, everyone. My name is Carol DeAndres. I'm the Stakeholder and Public Engagement Manager for the Master Plan for Aging team here at the California Department of Aging. And let's go back one more slide just to recall where we are. Thank you. We are happy to be with you today here at the Equity Advisory Committee on Aging and Disability, or EACAD for short, or EACAD. So thank you for joining us today. Today is April 11th, 2024, and this is the committee's second meeting for 2024. So thank you for joining us. I'm going to go ahead and go over a few logistics as we all settle in. So let's move to the next slide. We have live captioning available to you via your webinar functions. We also have ASL interpreting. So thank you very much to our interpreters for joining us today. Always a pleasure to see you. Meeting slides, transcript, and recording will be posted on the California Health and Human Services, the Cal HHS Master Plan for Aging webpage. You will find this meeting as well as past meetings. And committee members, thank you for joining us. If you could check your name display, if it still says EACAD committee member, can you please hover over the 3 dots, hit rename, and put in your name so that we know who has joined us today. Next slide. Again, I'm Carol DeAndres, and I'm the manager of the Stakeholder and Public Engagement for the Master Plan for Aging, and I'm pleased to be with you. Next slide. I want to go over some logistics for our committee as well as for our attendees. The chat function is enabled for committee members and CDA staff, California Department of Aging staff, state staff, and any invited guests to share meeting information, resources out to the public. The public's able to view that information. The chat and the question and answer functions are not enabled for this meeting. We will take your public comment during public comment period. And so we do invite the public to provide comments. Please hold them until the public comment period, which is towards the end of the meeting. The agenda states the time. And of course, though, at any time, you may submit your public comments to our Engage email box, engage, ENGAGE, at aging.ca.gov. Next slide, please. So for our public comment, we will go over it at that time as well, but just to let you know, attendees join.
Carol, you're muted.
I wonder how long I've been muted. Thank you. So, as I was saying, the public comment period, if you're attending by phone, please press *9, and then that will raise your hand and we will unmute your line. For our Zoom webinar attendees, click the raised hand icon and we will unmute your line. And again, you may submit your written comments at any time to engage at aging.ca.gov. Next slide. The purpose of the Equity Advisory Committee on Aging and Disability, EACAD, is to advise the administration on the implementation of the Master Plan for Aging, or MPA, as well as the California Department of Aging on the planning and implementation of aging and disability programs, services, data collection, and staff development. Next slide. And of course, we could not do this without our committee members. So as you can see here, we have many folks who are in the field of aging, disability, and as well as other advocacy groups. Next slide, we have what continues on. So all these People are sharing their time and their talent and their lived experience with an interest of advancing equity for historically marginalized and underrepresented communities. So we thank you for sharing your time and talent and lived experience to advance equity for the Master Plan for Aging and in the policies and programs to support the California Department of Aging. Thank you for donating your effort to us. Next slide. So now I want to turn our webinar over to Consuelo Gambino to give our land acknowledgement. Consuelo, can you raise your hand and I'll spotlight you?
Okay.
There you are. Hold on, let me get.
No problem.
Spotlight. There we go. Thank you, Consuelo. Please go ahead.
Okay. Thank you, Carol. I just want to say thank you, everyone, for being here today and all of your contributions and expertise with our committee. We appreciate all of you. My name is Consuelo Gambino. I'm the Tribal Affairs Manager at the California Department of Aging. I'm from the Yuki tribe and enrolled member of the Round Valley Indian Tribes in Northern California. It's an honor for me today to present our land acknowledgement to you. So today, as we attend the Equity Advisory Committee on Aging and Disability meeting, we take a moment to acknowledge the tribal lands in California in which we are gathered. For many centuries, the lands in California have been home to numerous tribes who have protected and respected the sacred lands in which we all reside. The tribes in California are sovereign nations, rich in culture and traditions passed down from our tribal elders. I'm attending this meeting from Roseville, California, and I acknowledge the indigenous homelands of the Nisenan Maidu people and honor their resilience and cultural preservation. So with that, I'm going to go ahead and turn that back over to you, Carol. Thank you, everyone.
And I'm going to turn it over to Marina.
Thank you and good morning, everyone. I want to thank you, Carol, for just starting us off in a good way and laying out all those logistics. And then also to you, Consuelo. It's always nice to start off with the grounding with any meeting, because as I say, equity work is hard work, but it's also heart work. And so that's what we're here today. I'm very excited for our second meeting today to welcome 3 new members. Unfortunately, David Villarino cannot join us. He may join us later this afternoon if his travel plans bring him home faster. However, if he does, we will give him a minute to introduce himself. And then also we have Lynn Fritz, who was recently appointed, and she will be joining us at our third and final meeting of the year. But I'm very excited to have Lynn as well. She's an enrolled tribal descendant of the Karuk tribe in Northern California, and she's a Native American psychotherapist. And also David's expertise and background is in working with farm working communities. And so really eager to learn more. But with us here today is Danny Soto from Open House. So I'd like to give Danny the floor just to say a few words about your background, and happy to have you here today, Danny.
Thank you so much, Marina. And thank you to everyone. It's a pleasure to be here. Just looking through the names on the committee member slides was just, it's an honor to be here with so much expertise, both, head knowledge and lived knowledge. It's just an honor. My background is in sociology, and I've studied and done work looking at disparities based on race and ethnicity, as well as sexual orientation and sexual identity. And I come to this work mostly from the angle of working in restorative justice alternatives to the criminal justice system when looking at elder abuse, particularly for families who don't want to engage with traditional criminal legal systems. And so that's just a little bit about me, and I look forward to getting to know all of you as time goes on. Thank you so much.
Thank you, Danny. Good to have you. And just as an update as well, we're still in the process of bringing on new members. And so I just welcome any of your recommendations as we move forward, especially in the realm of the disability field. And so with that, I want to just walk through our agenda. We have a lot of exciting updates and also a platform for us to engage in some conversation. So we will be hearing from CDA's director, our fearless leader, Susan DeMoris, on MPA updates and CDA updates. We will also be hearing from Chief of Research, Ross Lallian, on the LGBTQ plus study that I think ended in March 31st. So a lot of exciting news there as well, as far as the depth and reach of the communities involved in that study. Then I'm going to spend some time talking about a proposed concept for an aging and disability lived experience advisory board to work in partnership with us. And if I can have the slide moved ahead to the agenda so folks could follow along as I'm reporting out, that'd be great.
There we go. Looks.
Thank you.
Thank you.
Thank you. And then I'll be turning it over to our project director for the MPA, Jackie Tompkins, so that she can help organize us and prioritize our focus areas for the day of action that's happening in October. Then we will leave some time for public.
Sorry, Marina, can you back up just a minute? You were muted. You're still on mute. There we go.
Okay.
I think we're at public comment. Thank you.
Okay. And so we'll leave room and time for public comment, and then we'll move to wrap up and next steps and adjourn the meeting by 1 o'clock. So without further ado, I'll turn it over to Susan. Thank you.
Thank you so much, Marina. Good morning to everyone. And Danny, special welcome to you. We're so glad you're joining the advisory committee. And we look forward to welcoming the additional new members who have been selected. And we really appreciate returning members who are continuing their commitment to this work. Thank you all. I'm going to run through rapid fire when Callie moves the slide. Quite a few updates that I was wanting to share with all of you. We have had all of us in this field have had just an incredible first quarter of the year. And I wanted to capture just a few of the highlights for everyone. I know all of you get so many emails and opportunities to join webinars and listservs, and the list goes on, and it's hard to stay on top of all of the activity. I've never seen so much activity at the local, state, and federal levels as I've seen in recent years. And you get credit for why that's happening. It's, the momentum is shifting. I wanted to just recap for everyone that the governor's January 10 proposed budget held firm on programs that serve and support the most vulnerable members of our state and honored commitments that had been made in prior budget years. We are so grateful to the governor and Secretary Mark Galley, who heads up the Health and Human Services Agency, that almost dollar for dollar, the Health and Human Services budget was the same as it was last year. And that's an incredible feat of leadership given the state of the state's budget deficit. So we're incredibly grateful. The January 10 budget does set the tone for the year, and it's not the final budget. We're working through the budget process now with the legislature, and all of us are eagerly awaiting the governor's May budget revision, known as the May revise, where we'll have more information. I also wanted to thank the agency for introducing 4 program priorities at the start of this year. One of those program priorities that was introduced, and we'll share that in the link with all of you, is focusing on our aging network, the area agencies on aging that support older adults, people with disabilities, and family caregivers statewide. And so we're really heartened by the leadership there from the agency to really make our aging network part of the state's system of health and human services. We produced our third annual report to the legislature for the Master Plan for Aging. If you haven't seen that, we'll be sure to share it today as well. And we welcomed the oversight and feedback that the State Little Hoover Commission provided on the Master Plan for Aging. They held 2 full-day hearings last summer, and they produced an excellent report, and they have been very thoughtful partners in our work since their hearings last year. Our department, the Department of Aging, held an extensive stakeholder process through all of 2023. And in January of this year, we issued the final report. It's titled California 2030. And this is a good, an intensive examination of our state's aging network. And it includes recommendations that came out of robust quantitative and qualitative research that was done over the prior year, led by a steering committee. We're so thrilled that California was selected to be a national housing accelerator, and we commend our Department of Healthcare Services for their leadership there. We are a partner in that effort. As many of you on this advisory committee know, older adults are the fastest growing demographic among the unhoused population in our state. And we see this as just another tool in the toolbox that can really help us align the work of our federal partners, state partners, and our local efforts. As if that is not enough, the Older Americans Act is in the midst of being reauthorized. It's being considered by Congress. That's really the flagship program for older adult services nationwide and in California. And in preparation for that work, our federal agency, the Administration for Community Living, updated their rule for the first time in 35 years. They took a really comprehensive look at that. And in February of this year, they published a final rule. So we're in the process of conforming to that. We have until October of next year, and we're very excited to be updating our efforts to align with that final rule. And then last, but certainly not least, California voters approved Proposition 1, and we are eager to get to work there on how we can support local mental health and behavioral health efforts, and how we can build a stronger bridge to housing, as they are so closely related. And we have work already underway related to our Master Plan for Aging and how we can be full participants in Proposition 1. So that's a lot. I wanted to capture it all on one slide. And then I just wanted to, if Callie would be so kind as to move to the next slide. I wanted to share with you, we're considering a draft agency-wide equity strategy now that organizes our work in 5 domains. And I just wanted to share with you, this is draft, getting very close to completion. Marina, our equity officer, is point on this for the Department of Aging and doing just an outstanding job with her team in contributing feedback. But I just wanted to give you a preview of the 5 areas that we'll be focusing in. And later in today's agenda, we're going to really dig deep into the community partner engagement domain. That's where we see the role of this advisory committee. And this has given us thought about how we could even deepen our commitment to the community and our partners. So we'll be hearing more on today's agenda about that. And then I believe there's one more slide, maybe 2. I wanted just to talk about some internal efforts that you might not be privy to. The governor convened a Tribal Nations Summit last month. It was just incredible. This is a government-to-government meeting that happens annually, and many tribal nations were in attendance. It was a full-day session, great learning, great networking, and the tribal nations in attendance were all given the opportunity to share with the full audience their priorities and where they want state leadership and resources to be focused. It was just an incredible event. I shared on the previous slide, we're finalizing the draft equity strategy plan for our agency, and we're just so proud to be a part of that effort. You'll hear from Ross about the conclusion of the LGBTQIA+ survey, and I can't thank our partners, our community partners, our academic partners, our advocacy partners for their incredible contributions, participation, and promotion of the survey. Danny, thank you to Open House. Please take that back with you. A phenomenal partner in this work, but many, many others. And then just last week, the Department of Healthcare Services launched their Medi-Cal Health Equity Roadmap Initiative. And that's absolutely something that we support for our partners at DHCS. And as you can imagine, that lifts the boat of every Medi-Cal beneficiary in our state. And I don't know the current number. I want to say it's 13 million, but don't quote me on that. It's a lot of people who rely on our Medi-Cal program. So that's something I encourage you all to take a look at. And then Sarah Steenhausen, if you're on, we'll ask you to just touch on the next slide as we tee up for the day of action, just a refresher on where we're headed with the master plan for aging. Thank you.
Great. Thank you, Susan. Lots of exciting work, and I'm so pleased to be here today. I'm Sarah Steenhausen, Deputy Director of the Division of Policy Research and Equity, and our division, including Marina and her team in the Office of Equity, are charged with advancing the master plan for aging. So I wanted to just give a little context to our work in long-term services and support system change, all of which is undergirded by equity. So the way that we're advancing this work is really thinking of it in 4 distinct and interrelated buckets of work. First is the issue of navigation. So thinking about the challenges that older adults, people with disabilities, and caregivers face just in trying to understand what services are available, what their benefits are that they might be entitled to. We all know how hard it is for people to get the information they need to make informed choices. So we see this as the first critical element of system change, and we are working towards kind of the planning of a no wrong door system that includes both a consumer-facing web portal that's statewide, spanning issues across health, human services, housing, transportation, and more, and a contact center with live help available, so that there's one place that people can go to for information, and then you can get the warm handoff to the local partners. We have a governing advisory board at the state level that's working on this. And we're just at the beginning, but it's part of a kind of multi-phase process, and we're really excited about moving this forward. Second key system issue is, even if you figured out a way to help people access the information they need to make informed choices, we have a challenge in terms of ensuring that we have the programs and services available on a statewide basis that people need. So we are engaging along with our partners at the Department of Healthcare Services in a 2-pronged analysis of our home and community-based service system, looking both at the Medi-Cal home and community-based service programs, that's the part that DHCS is leading, and then CDA is leading on the analysis of the non-Medi-Cal home and community-based services. These are programs and services that span across departments, and we are including within that an analysis of housing stock, affordable, accessible housing, as well as transportation availability, because we recognize that even if you have home, if you don't have a home, you don't have home and community-based services. And if you don't have a way to access those services through transportation, you also don't have, it's not meaningful access. So the results of the gap analysis will be out this winter or at the end of this year, and then we will build a roadmap that tries to set a path forward for California to achieve statewide access of our services. Third really critical prong, of course, in system change is the workforce. And I know everybody here is very well aware of the fact that we have a tremendous challenge in our direct care workforce in particular, both ensuring that we support our unpaid family caregivers that provide, core services or core support to so many older adults and people with disabilities in their home, as well as our paid direct care workforce that provide the critical hands-on care that people need. We have a shortage, and we need to ensure that we are meeting the needs, building this workforce pipeline and providing the training and incentives that are needed to ensure that we have the culturally responsive workforce of the future. And last but not least, if we've addressed all these other system issues, we still have tremendous challenges in terms of how people finance and afford their long-term services and supports needs. So there has been a couple of different efforts underway. There was a long-term care insurance task force that looked at the feasibility of standing up a statewide public benefit for, or a public option for long-term services and supports. That was a report that was released last fall. The administration does not have a position on that, but that is one area of work that's been underway. And then second, we are undergoing a $5 million initiative to explore long-term services and supports and affordability policy and research development. So we're going to be doing a comprehensive analysis of potential options for the state to explore in addressing this long-term services and supports financing crisis, including approaching a draft demonstration, or sorry, a pilot demonstration through Medicare to see if Medicare would be able to pay for a limited benefit in home and community-based services. So that work is underway, and we will begin our stakeholder engagement soon. So all of this is, to summarize, our important efforts to try and make the system more person-centered and really reform our long-term services and support system. So I will pass it back to you, Susan.
Thank you. And at this point, I get to pass it back to Marina. Unless there are any questions, I know we covered a lot of
Looks
ground
like
there.
Marty has a question.
Well, thank you. Thanks, Susan and Sarah. Sarah, great presentation, exciting work. I have two questions, probably no surprises. Number one is on the road, or the gap analysis and roadmap. I know you've done a couple of webinars, but is there anything out in writing or a link already available? And I know you're not done, and there's going to be more, if I heard you right, in a few months. But that's question number one, and I can pause there, and then I want to ask you one financial question.
Sure. Also. We don't have the gap analysis out yet. We do have a website, and so the website, we can put the page up to that, so you can get access all the materials that have been released through our public webinars. So hopefully that will be helpful at this point. But as soon as the analysis is ready, we will be releasing it.
And I assume at that point you'll be doing some webinars.
Oh, yes, absolutely. Absolutely.
Okay. And then on the financing side, I appreciate the $5 million that the department has to work on this. I appreciate the Medicare idea. I'm wondering what your thoughts are in a deficit year about how the administration can keep moving forward on long-term plans for LTSS financing and affordability. Yep. I'm worried that they'll stall, yep, or that you'll do what you can based on what you had already, but not be able to do more. Any thoughts or discussion about that you can share?
Thank you. That's a really important point. And I would say a couple of things. One, I think that this work will be setting us up for the future in terms of understanding, what is the business case to be made for investing in this population, but also, again, really trying to look at leveraging the range of funding streams that might be available. And I think that what we're learning more and more is that there's not one silver bullet. We have to have a multi-pronged pathway across payer sources. We know that the general fund can't finance the entirety of long-term services and supports needs. So we're trying to think of ways across Medi-Cal, Medicare, and other funding streams. So to your point, Marty, this absolutely will keep the ball moving. And I think it's part of a longer-term solution. I don't anticipate in the next year to two we'll have solved this crisis, but we're making good headway. And with your advocacy, the ball will not get dropped.
Thank you. Could I just say one more thing, which is I think it's a key equity issue as well for this committee or this work group, in the sense that, we know that people who, diverse populations, women typically are lower income and are less able to afford the kinds of services we're talking about needing here. So just as I think there's a pretty tight link to the work of this group. So thank you, Sarah, appreciate it.
Thank you.
I think we
Vincent.
have,
Yeah.
thank you.
Hi, thank you for the presentation. I'm actually dealing with long-term care things around my mom as we were speaking. But I wanted to share an experience I had a couple of weeks ago. We were in the renewal, and it's the first time in 4 years they've done that. And I want to say the staff that I made a number of phone calls starting in the morning were really very friendly, but then toward the end of the day, I made my last phone call because each one referred. And I was told, oh, this is the number that you need to call. And they gave me the number, and it was the number that I started calling in the morning. And so I just want to point out, if that happens to someone like me, who is fairly well connected and knows and can call people, I just wonder how we make this equitable for folks who don't have that and who don't know. Because honestly, people just want to give up. And you're
Such an
usually doing it
important point.
under crisis. And like this morning, like I was trying to figure out if my mom, she has a tooth infection, if she's covered by her Medi-Cal long-term care. And they said she is. I reached out to the facility. They had to wait till May till they actually get her renewal. I said, I don't think that's true. I said, if she's covered now, you should be able to get her a dentist. And so I just, I think we need like advocates, because this is just too much. I have a job that allows me to call Medi-Cal and state time. I know what questions to ask usually, and if I don't, I can figure it out. But for people who are just trying to take care of their, it's also, I find it's like another like half-time job. And so I just want to kind of put this out, to us as a group. So how do we address that?
You are so right. And this is exactly why we need to hear from this committee. And I think that in our discussion today that Marina is going to be leading on this concept of a lived experience advisory board, we need to be able to take the perspective of the person and tie it to system change, because you're absolutely right. We're trying to do this with our work to make the system more navigable through the development of a no wrong door system. But where this committee comes in is how we ensure that there's cultural responsiveness in that approach, so that people, no matter where they are, who they are, don't have to feel so confused and by the system, and then just end up not getting the services they need because they can't navigate it. So really important point, and thank you for elevating that.
And
I don't know if
I do want to say that though the staff, like especially in Santa Clara County that I talked to, amazing, and coming out of COVID, doing all these things and really wanting to be helpful. But at the end, it was just kind of like, oh, I have to call the same number. So anyway, but that's, so I don't want to be completely like, I don't do this as a negative, but just to put this out there, this has been my experience. How do we address this? And thank you for your response.
Thank you.
Thank you both for sharing your experiences and just helping us along. It's really great feedback to hear. So with that, I'd like to transition to Ross's presentation on the LGBTQIA+ study. Kelly, if you could, thank you.
Thanks, Marina. Hi, everyone. Thanks for having me. Ross Lawlian. I'm the Chief of Research with the Department of Aging. So I'm here today to present a quick update on our LGBTQIA+ survey. So you go to the next slide, please, Callie. So I want to start with some background about why we pursued this survey. As you recall, the students have collected data on the older adult LGBTQIA community. Without data, we don't fully understand the needs and experiences of the community. We also aren't allocating resources as accurately as we could be. And that's why this survey was so important. And so this round of the survey was to collect baseline data. Our hope is that this type of survey is administered on a periodic basis going forward. And the overarching goal with this survey was that these data would inform policymakers, healthcare providers, advocates on how to improve healthcare access and quality for the LGBTQIA+ older adult community. And so these improvements may include things like expansion of trading across healthcare networks, improved access to LGBTQ affirming medical and social service providers, and the development of programs based on the needs of the community. And the survey also advances the goals of the master plan for aging. So it touches on several goal topics, but really gets to equity, which is what the MP is grounded in. Let me go to the next slide, please, Callie. We worked with an awesome team on this project, so I'm going to give them a little shout out. Open House was phenomenal. They led efforts to ensure that the community helped to inform the survey, did an awesome job with engagement of the community as well as key stakeholders. Our partners with the Citrus team at UC Berkeley really kept the project on track. They're important leaders and thought leaders and served as great collaborators and project managers on this effort. And then finally, our partners at UCSF led efforts to actually create the survey instrument, conducting the actual analysis, and they're going to create outputs as well. And this as a reminder, to qualify to take the survey, one had to be at least 50 years of age, to reside in the state, and be a member of the LGBTQIA plus community. And the survey was available in several languages: Tagalog, Chinese, Spanish, and English also. Next slide, please. So I want to share the timeline with you briefly because we've just passed a very important milestone. So road 3 is data collection, essentially the period when the survey is open. And as you can see, the survey closed on March 31st. We moved on to the data analysis phase, and we'll begin to prepare outputs. And then we look forward to dissemination of outputs sometime in probably early June-ish, right around there, maybe late May. So next slide, please. So unfortunately, I don't have findings or detailed data to share with you today because the survey just closed. The UCF team is cleansing the survey data. But what I can say is that I'm really proud of the response rate. So we started with the goal of reaching 2,000 responses. We more than doubled that, approximately 4,725 responses. And these responses are from throughout the state, all regions, rural and urban communities. More responses from urban communities. That was kind of expected, but it's important to have representation from rural California, kind of build upon that. In the coming weeks, we'll have a lot more information about the demographics of survey respondents and the results as well. And in terms of next steps, the team is currently analyzing the survey data, and they'll work on developing the following over the next several weeks: the final report, executive summary, infographics, fact sheets, and we want to share the survey data in the form of an open source database safely, of course. Next slide, please. So I have one more slide. It's a really quick update for today. The next slide is kind of an important part 2 of the survey. So a next step I want to introduce today is focus groups, which is kind of a spin-off from the survey. So we asked survey respondents if they'd be interested in joining a focus group. And over 350 folks have expressed interest, which is more than we expected. And Angie Prone, who's a very talented colleague, an assistant professor with the UC Berkeley School of Social Welfare. She also directs the Center for Advanced Study of Aging Services. Angie's going to lead these focus group efforts. And essentially the purpose of these focus groups really dig into the survey findings and build upon the actual findings. As an example, the Black trans community faces multiple forms of discrimination, and that might be difficult to fully understand just from survey data. There's probably other nuance among experiences. They may not be reflected just with the actual survey data. So we're hoping that the focus groups allow folks to kind of bounce ideas off each other and flesh out ideas. So Angie and team have been prepping for this work, and they're going to conduct the focus group soon. They plan to disseminate outputs last quarter of this calendar year. I don't have exact dates, but we'll be working on this soon. So really excited about that. And so that was the last slide I had. This is a very brief update. I hope to come back and share findings with you in the coming months. Of course, happy to answer any questions that folks might have today as well. Thank you. Vincent, go ahead. Sorry, I thought your hand was up, Vincent. Maybe it was up from last time.
Oh, sorry. My mute didn't go up. I was on the advisory committee for this, and this is like one project that I made sure I attended every meeting. Open House led an amazing process, and they actually presented last week at the American Society on Aging, and it was really well received, and I was able to share experiences with a number of people. What I wanted to ask is that when you do the focus groups, that you include focus groups in different areas for older people living with HIV. We've learned in San Francisco that it's not something that people will disclose. And given in California, we have SB 258, which names them as a population of significant social need. But I think you need to do a focus group specifically around that. I sent 60 people to our city's San Francisco's needs assessment for the Department of Disability and Aging Services. There was not one question about being an older person living with HIV, so it showed up as no problem. is not a problem. So I would just like to request that. And it also needs, in addition to the urban areas, it needs to be taken to mind you, because a person who is living with HIV, their experience in the rural areas is very different from those like in San Francisco, Los Angeles, or places where we have a number of, of resources. I mean, the last thing I wanted to just say is that we are going to be, I'm working with SAGE to address this issue as well as LGBTQI aging with the Older Americans Act, and we'll be hosting a webinar, I think in May, around some specific recommendations that we have around that. So just wanted to put that out.
Thanks, Vincent. Appreciate the feedback. Thanks for your help too with this, Vincent. The advisory committee was phenomenal. Thank you all. I think Marina, I'm gonna hand it back to you.
Yes, thank you, Ross. I appreciate the update and congrats on all the effort. And thank you to those committee members who also were involved in the process. So very exciting news. So this next section, I have listed as Centering Our Work, EACAD and the Proposal for an Aging and Disability Lived Experience Advisory Board. I'm going to describe the concept and the proposal, and then I want to leave ample time for us to have some discussion around your ideas, your thoughts. And this really ties back to what we've been talking about, being very intentional, being person-centered, and how we align efforts, not only across CDA, the MPA, but at higher levels, at agency and beyond. And I really feel that with the 6 committees that we have, that we can create some synergy and uniformity that will weave and thread equity based on your experience and others that we involve in the process. But before I get into the proposal for an Aging and Disability Lived Experience Advisory Board, or an ADLIB, if you will, I want to take a few minutes to go over the survey that we issued, just to go over your results and a few of the priority areas. So if we could go to the next slide, please, that would be very helpful. So first and foremost, I want to thank you for completing the EACAD survey. You're probably similar to me. You receive a lot of surveys to complete. Unfortunately, we didn't get, a bigger response rate than we had envisioned, but I just wanted to thank you that out of the 15 members, 5 members completed the survey, and the top 3 priorities included the MPA equity framework that Ross continues to work on, communication and messaging that would extend to older adults, family caregivers, and persons with disabilities. And this is more about informing them about resources that are available, services provided, because in many of our underrepresented and underserved communities, there are still questions about where to go and how to access services. So we flag that as an important area to continue on and messaging and communication in a culturally responsive way. And then the last prioritization was based on several topics from the LGBTQIA study, aging farm workers, tribal engagement, and caregiving resources and support. So with that, just like to acknowledge you all that you are a very ambitious group. And I am glad to be leading efforts with you. At the same time, I think it's very important for us to really elevate those priority areas and how we can influence change, but doing so with community in mind, centered, and in partnership. Next slide, please. So based on the survey results and in an effort, like I mentioned, to keep community voice front and center, we began exploring avenues to be able to do this within the MPA, primarily given the number of initiatives and strategies already underway, taking into consideration that our time is limited together and the availability of resources. So while brainstorming, a few questions arose, and you see those questions on the screen. And that's really about how to advance equity within the MPA. How can EACAD inform the understanding of the other MPA advisory committees, and how can EACAD uplift the voice of the consumer, of the constituency that we serve, and all policy discussions. Next slide, please. And these, in my estimation, and I'm coming to you as well, that these questions are critical as we build momentum and align our efforts with the state, specifically with the California Health and Human Services Agency, as Susan mentioned earlier. And this is a real opportunity we see in terms of agency is responsible for leading equity efforts for many state departments and offices. And this is done through their Justice, Equity, Diversity, and Inclusion Subcommittee, which I belong to. And as Susan mentioned as well, we are in the process of providing input and feedback into the drafting of a equity strategic plan for California Health and Human Services through Dan Torres's leadership. And we feel that within those domains, we can really hone in on the theme of community partner and engagement. So the overall aim of the California Health and Human Services Agency Equity Strategic Plan is to achieve greater alignment and effectiveness in the agency's effort to promote equity. And we saw earlier the 5 key priority areas listed. And this is really focused on dismantling systemic barriers, fostering collaboration, and streamlining data systems, and prioritizing equity throughout decision-making processes. This is where we could really be leaders and advance and create programs that address persistent and systemic inequities. And we do so by having this responsibility of hearing and staying connected to the communities that are the end users and the communities that we serve. And I really see this as being part of a model of community-based participatory practice. So as I mentioned, focusing in on the theme of community partnership and engagement will really give us that edge of being able to weave equity throughout our MPA committees. Next slide, please. So how might we be able to do this? How can we integrate lived experience into the MPA decision-making process? As we all know, that when we hear from different multicultural communities, that we're able to grow our understanding and stay connected to emerging populations that are arising, the ongoing barriers, whether it's related to access, language access, and just how we try to really be intentional about setting priorities and also thinking differently to ensure that services and supports are accessible by our communities in a language that's appropriate and with a workforce that can really make a difference. Next slide, please. So I don't think I need to remind this group as to why it's so important to stay in touch with that community voice and that lived experience voice. It's very important for us to keep the consumer perspective represented and that it not be forgotten. We also understand that having the community voice strengthens programs. It helps to ensure that the research and services address the issues that are most important to those we serve. And so there's tremendous added value in doing so. And with the number of priorities that we identified, having that partnership and having folks come into our space and being in partnership, sharing power, it really lends itself to an awesome working relationship that could impact change on a broader scale. And the other point I would really like to make is that working in partnership with community really fosters collaboration and self-determination and empowerment. And I think it just really opens an avenue for us to be innovative and create programming that is really well informed for our users. Next slide, please. So this illustration here just really speaks to how ad libs can be utilized and how the recommendations that are provided by the ad lib to the EACAD can really help support the other committees. So for example, if we need subject matter expertise, that could be imparted. We can instead of working in silos, we could be silo busting and be able to have these communications across the board. And as I mentioned before, we can create some synergy and uniformity that will help us gel and create that communication. Also, I think that another benefit of creating the ad lib would be that we can build our capacity and promote that lived experience lens that is very much needed in our decision-making process. And so we can move to the next slide, please. And so what I want at this point is your input. I've come up with some questions that are presented to you here, and I want to stop talking and I want to hear from you all about what are your first reactions to the ad lib concept? What has been your experience? How do you see ad lib partnering with EACAD? What kind of structure does that look like? And just getting more of your thoughts about if we do move forward with this concept, what that representation, recruitment, and membership selection would look like, and what supports are needed to make this happen. So at this time, I'd like to turn it over to Sarah or even Rigo to see if there's anything more they'd like to add, and then I'd like to open the floor for discussion.
Sure. Marina, I think you did a great job kind of summarizing this concept, and I love, I'm super excited by this because I think that, you know, just Vincent, for example, your experience that you talked about today with trying to help navigate the system for your mom well illustrates, I think, that if we had actual end users of the system in our population that we could listen to regularly and hear from, we can take those experiences and translate it into real recommendations to the other advisory committees that then kind of, you know, have the policy and data research lens on our broader master plan for aging implementation. And we've seen other lived experience advisory boards just be super impactful, say at the California Interagency Council on Homelessness. It's been really impactful to have a range of individuals who were formerly experiencing homelessness and understanding from their perspective what they are going through and where the gaps and where the needs are. So as Marina said, we're just super excited to have your perspective on this, and this committee would be really play a critical role in kind of being almost like a steering committee that works closely with the Lived Experience Advisory Board to help frame the discussion, to work closely with them to help find the consumers that could participate in this. We understand that we would be need to be very mindful of ensuring a culturally responsive approach. So that would mean ensuring that we had the resources for translation, the resources for ensuring caregiver support if people need to go to in-person meetings. Anything we can do to help ensure that we're truly reaching the consumers that we need to be in this work. So I'll pause there, and I didn't know, Rigo, if you wanted to add anything or if Susan wants to.
Yeah, so happy. I think I am all in favor of this. I think it is. I think this is an incredible opportunity for us to really engage those who are often, you know, first and most impacted in communities. I think it's a way to really get diverse perspectives, because as we know, not all older adults age the same, nor do they feel the impact of services, good or bad, or indifferent in the same way. And it's really, I think it's a great opportunity for us to be able to further perhaps lean into what data may be telling us, and, you know, through segmentation, and really hear from folks directly, representing different communities, different, walks of life and experiences, which, you know, helps us to really deepen our understanding of the conditions that lead to certain situations. And I think it also is a way of of sort of being the canary in the coal mine sometimes, in that we don't move forward in inadvertently creating systems that don't really work for all older adults. And lastly, I'll say I think this will give an opportunity to really engage people in a meaningful way, and that they feel they are co-creating solutions together.
I would just add a few thoughts. Thank you for that, Rigo, and Denny, thank you for your comments. And what I especially like about this, and then I want to hear from committee members, is the intersectionality that, this is an opportunity to wrap ourselves around any given topic or issue or program or priority and have multiple perspectives on it at the same time. And it also speaks to the evolution of this outstanding advisory body that was formed as part of the Master Plan for Aging in the very beginning days. And now we're in year 4 of the Master Plan for Aging. And so I just want to commend the group for rethinking about how we can be most impactful going forward as the Master Plan for Aging matures. Alvira, you're on deck.
Yeah, thank you. Thank you very much. No, I think this whole idea is very visionary, and I think both Rigo and Sarah, just articulated it very well. My question is more on sustainability. I don't know what resources are needed to keep this going. And I think Sarah mentioned something about culturally appropriate populations that have never articulated or been in the forefront in terms of their needs. And, being from a farm worker background, that's my reference point. So my question for further discussion, and maybe your planning, is what resources are needed? Language, facilities, electronic devices, if you're going to have a Zoom meeting, for example, and interpreters. And given all your work with the MPA and all the different committees that you support are involved, can this idea move forward and be sustainable over a year or 2 years? And I guess that's my question. Thank you.
I'll just jump in there, Elvira, Marina, if that's okay. That is a very key question. So 2 things. One, in terms of resource needs, we're going to be meeting, with our colleagues at the California Interagency Council on Homelessness to really find out what it took for them to stand up their lived experience advisory board, recognizing that we don't have to do it exactly the same way. But yes, we're going to be exploring where we may be able to find resources to do this, because that's something we will need to do. And we're hopeful that, given the importance of this body of work, we'll be able to pull together, some external resources, hopefully, to achieve this vision. So thank you for that question. I don't know if anybody else wants to add into that.
Vincent?
Me again. Sorry. I do a lot of this kind of work. And one of the things is that I know that I think it should be intergenerational. A lot of my peers have been always willing to do this work for free because they were like the lone voice. And it's the younger generations, they don't want to do this for free. I've even been told, you were willing to do that, we're not. We know the value of our lives. And then they would tell me, we learned that from you because you spoke up. And so I think it needs training because it's not easy to tell your story sometimes. I recently sat in a meeting where a former colleague talked about the need to take their life, and there's actually legislation here. And I told him, you don't need to do that on your own. I will do that presentation for you, because he was suggesting, oh, you need to go talk to these people. I'm like, no, you don't. It's like, I'll do this for you. Let's do this together. And so the other thing that I find comes up a lot, and I was recently doing something about medical mistrust. They wanted to pay the doctor $500. The doctor said, that's not my usual fee. Can you pay me $750? And I said, well, what are you going to pay the patients? And they weren't going to pay the patients. It was supposed to be a joint thing. And then when you start to question this, like my staff question things a lot and I try to find an answer for it. But a lot of times when you ask somebody, why is this? They will say, well, this is the way it's always been done. And I think that that is the thing that we need to break. Like, you know, part of the reason why in the upcoming election that people are so unhappy with the two candidates, because this is going to be business as usual or something going to really change. And so I think we need to do training. The SCAN Foundation really put out a proposal for folks to create small groups like this where you could train folks and they could, and so maybe something like that. And mentoring also. I mean, like, we have somebody who's been at our agency for 25 years, they're retiring. You know, like, what about their experience? What's going to happen? Because nobody knows why half the things are done the way they are. And then I think a series, we talked about this before, but a series of articles around that where people talk about this and what the kind, and so, because then you will always see like, oh, I see myself there. You know, I can do this. And then to really find out, you know, what it is that people want to do. But I also think you have a lot of community-based organizations who are already doing this work and could also use the resources, because maybe if you do it at the government level, it's going to be cost prohibitive. But if you bring it down, you already have people. Open House has a number of people, number of groups. We do. There's groups. And so look at how we can partner with them. And then maybe even create a network across the, you know, where people can choose who the representatives are. So it's not always the same people.
Excellent. Thank you for that.
Thank you, Vincent. I took some of those suggestions down. We'll move to Marty.
I get myself unmuted here. Thanks. I think really good idea for the group. And I would urge us to think a little broader in terms of lived experience and what I would call consumer voice, in the sense that I think this state and CDA, you guys are actually pretty good at paying attention and trying to set up ways to do this, and that's a good thing. But I'm struck by, you know, Sarah earlier in her presentation about the roadmap and future directions for LTSS coverage, talked about using Medicare, and we know that at least half the Medicare enrollees, and yes, I'm in the healthcare world, so I think that way, are delivered by Medicare Advantage or private plans. People get their services through those. I would love us to have an advocacy effort that would push to have a consumer representative or two on every health plan board doing business in the state of California. I think it makes a huge difference to have more than just money people and finance people. And yes, it goes to the point of people would have to be trained and have support and that sort of thing. But I hope we won't limit ourselves to thinking about lived experience on public oriented committees and such, but think about these private for-profit groups that really control the delivery of care. I know Rigo's on the phone. Rigo works for the foundation, but wouldn't it be great if the SCAN health plan took the lead in doing something like this? Maybe you're going to tell me that they've already done it. That would be great. But that sort of thing, you know, and having some regulatory backup to push that kind of consumer voice and lived experience in these organizations that impact us so heavily and impact our community so heavily. Thank you.
Thank you, Marty. Appreciate that feedback. Ephraim.
Hello, everyone. I also obviously echo that this is an incredible idea. When I'm thinking about moving forward to really get the true voices that we need at the table, I think really thinking about some intersectional mapping. I don't know the cultural fluency that the committee itself has to, you know, navigate conversations with tribal communities, the various tribal communities, rural Americans. And I think if there is a possibility to consider various intersections that hit these marks. Like, you know, a queer aging adult in San Francisco has a universe apart of needs and resources from a rural queer disabled person, for example. So if there is a possibility to consider the depth of intersectionality that we're interacting with when it comes to the population that we're trying to bring forward, and if the individuals that, you know, Vincent's idea around there are folks on the ground doing this work, so really partnering with them, because the passport of their presence, but also their bodies and their shared identity with those communities will be really vital. But I think the last thought that I have is just really really laying out and being honest about what the feedback mechanism will look like with this community, because oftentimes people are coming and engaging with these committees, offering their real life stories and their trauma, et cetera, and it kind of gets pushed out into this void. So showing these participants how their input in real, like the effect, whether it's 2 years, 3 years, whatever that looks like, really setting expectations, providing, you know, an honest timeline, and then really being able to show in a feedback mechanism, this is where your input landed in the way that we're trying to address this work. I don't know if that last point makes complete sense, but.
Thank you. I really appreciate the sustainability piece and honoring those with lived experience and consumers without honoring them in terms of their time. And this has been a conversation in other fields as well, in terms of coming to the table and not being, you know, compensated, not being, you know, just offered gratitude in so many different ways for their expertise and knowledge. So I really appreciate you know, the idea of just being thoughtful in terms of who we invite and how we structure it for sustainability purposes, and then also just the impact of their voices, how that impacts our policies or services, because in working with stakeholders as well, that's one of the things is, you know, coming back to the table and asking, and then they say, well, we've mentioned this like for a few years now and we don't see it represented. And so the expectation and level setting is very huge in this space. But I'm very delighted to hear that there is, you know, there seems to be some preliminary support. There are many considerations, and I appreciate the intersectionality recommendation about mapping, and also just being mindful of the tribal and rural and the networking and partnership piece. So thank you. I don't know, let me see if I can see other hands here. Vincent, is that, would you like to make additional comments, or is that
Yeah,
from?
sorry about that.
No.
The other thing that, you know, one of the things we recently started Assist Black Women's program. And what I have learned is that my sexual health needs as somebody who lives the epidemic I can meet those, there's resources. But what we found with this is like, they don't know what's available. Like they don't have anything to compare it to. So I do think that we need to look at gender also and the inequities around that. I've also learned that, you know, as a man, like I sometimes like to discriminate against because it's not the traditional role in traditional, but then I see what women go through in taking care, you know, having a meeting, they bring their children, they need childcare. And these are things that they don't know that they can ask for, because that would help to ensure their participation. So just to think about that also as another lens that we look at this. I mean, we said intersectionality, but, you know, again, we've always had sort of like a binary model that we've worked with, and now there's just so many different things and families look different. So we need to think about that as we're doing this.
Yeah, can I say something? I think that's, you know, I think this is an amazing opportunity, as I mentioned earlier. But certainly, I think those are going to be some of the challenges for us, is what steps can we take? And this is going to be something I think we could all really work through together in really assuring that we have the right representation, right? Because, you know, and I think we're going to need to spend some time, and perhaps, you know, there's different models, but we're going to need to really be clear about what we mean about people with lived experience. How are we actually defining that? And what are the identities that we are really uplifting? And I think we need to align together as a committee as one of the first steps we're going to need to take. And just thinking about the richness of this conversation and I think the cultural mapping, I think all that, I mean, those are right spot on. These are some, we're doing similar work with the SCAN Foundation, as Susan and Marina know, and Sarah does as well, and so these are some of the challenges that we've been facing and through that process, and how do we become truly representative? And maybe we think of it, and certainly not here to solve it today, but just thought, maybe it depends on the circumstance and the situation and the systems that we're talking about, and maybe whether data shows whom within the segmentation of older adults are being impacted, But anyway, just again, those are things that have resonated with me as we're having this conversation.
Yeah, thank you, Rigo, for mentioning that. And so my next question is really about, when we think about representation, I think it would be great for those who are interested. I could arrange a meeting and even, invite Ross so that we can have some data to help inform some of that. So if you're interested, please reach out to me or my team, and we can have a preliminary discussion and maybe frame something that we can then present to this group at our third meeting as we unfold. And so I see it as an opportunity for me as well to talk with the other MPA committees to see what they have in motion already, so we can do a landscape analysis of other committees and get their input as well. And then I'll stop talking there because I see Julia has her hand raised.
Good afternoon, everybody. Sorry I was late, another meeting. But as I'm listening to this portion of the conversation, in thinking of recruiting other folks who could be part of this next level of advisory group, might be interesting to consider also identifying people in this, whichever communities up and down the state, but an individual who is directly aligned with some of the different lawmakers' offices, whether that's county, regional, across segments of the state, so that as we're getting information of lived experience, perhaps there's a way that those folks who are working on the side of helping to craft legislation, provide local resources, help their local constituents plug in, that a key person in some of those offices are also aware of how all of this works. I think a lot of times we assume that if somebody is in a legislative office of whatever level in the state, that they know about all of this, and maybe they don't. I had a conversation a few months ago with a friend who works within the congressman's office, and I was the one educating her about the services of the AAA. And she had no idea that it existed. And I thought, okay, there's a disconnect there. And it was great that I was able to provide that. And so to your point, Marina and Vincent, of the lived experiences of sharing that information and knowledge and what you've been through, and you're just doing it out of the kindness of your heart. And I thought, well, she works for the congressman and she doesn't know any of this. And so it might be interesting to be able to identify some folks that we can then pull in into these individual groups, however they form. Let's not forget about that aspect, so that we can help educate some of the local policymakers, as well as making sure that they know what's happening up and down the board with all of the different CDA plans. So just something to consider.
Absolutely. Thank you, Julia. And I think that dovetails nicely into our next conversation regarding the Day of Action, where we will invite a lot of policymakers and influencers to help us elevate and keep the momentum for our equity platform. But I would really appreciate, so I'll be definitely reaching out to some of you to just talk about what the representation will look like. And how can we lift this? Of course, obviously, like Sarah said, we will be looking for resources and supports to help lift this, sustain this. But I'm very excited about it as well. I think there's a lot that can come from it, and I can just see great impact coming our way. And most importantly, I just think it keeps us grounded in why we're here and doing the work that we're doing. So I want to just see if there's any other comments, even from you, Sarah. Last minute thoughts before I transition to Jackie.
I saw Vincent had his hand, but my only thing was going to be, and I'd love to hear from you, Vincent. I think we can regroup internally, Marina, and then whoever from this group would like to be part of this planning process, let us know in the chat. And then when we regroup, then Marina and team can follow up, and we'll do some investigating in the meantime about how we might be able to move forward. And I will say, just to the points that have been raised, I do think the most effective way to advocate and to express issues is through the voice of the person. And we have heard from our day of action last year that we're about to talk about that the most impact was from the panels of the panel where we had real people and talking and engaging. That was the one that had where, we heard from state policymakers that it stuck with them and they heard it and it resonated. It makes these issues real rather than just an academic wonky discussion. So Vincent.
Yes, this is kind of a funny comment, but when we talk about lived experience and what Rico had said, I've been in groups where we didn't vet the people and then they start arguing over whose lived experience was valid. But on the plus side, I've been in some, like a Pacific Islander group recently where we were talking about that. And I was so touched when one of the young women said, well, you could have a room of 50 Pacific Islanders, they would tell their story and they would all be right. And I said, I've never heard that in my 30 years of doing that. And so I do think, and also for like the Latinx community, it's not one monolithic community that you can just say these two people represent. The Black community is the same. So those are some things that I think we should think about. And if we are going to get people up in front of the policymakers, it's not good to have them arguing over who's more, like for me, like you're not Asian enough. And I'm like, I'm a Pacific Islander. So I'm here, so those kinds of conversations.
Thank you. Thank you for that. It's very important. And thank you for saying that every one of their, what they share, their feedback is important. It's a good reminder. All right. Anything more on this discussion? And thank you to those who have already included, your name in the chat to volunteer. I appreciate that. And so just doing one last call. Any more thoughts on this? All right. Thank you so much for your willingness to share. And as I mentioned, I will be following up with those who put your name in the chat and maybe a few others I may reach out to. So I appreciate the time. At this time, I'm going to turn it over to Jackie.
Hi, everyone. Good morning. Doing a quick check, making sure my audio is coming through clearly.
You sound great.
Okay, fantastic. Thanks for having me this afternoon. My name is Jackie Tompkins. I serve as the Master Plan for Aging Project Director housed here at the California Department of Aging. I'm going to talk a little bit today about our California for All Ages and Abilities 2024 MPA Day of Action. I also want to just kind of share that I see a lot of promise, and I'm very much encouraged by the discussions we had with regards to thinking through how we can create, nurture, foster, and sustain a lived experience advisory committee to support this work moving forward. I appreciated all the inputs and thoughts that went into that discussion, and I think that there's a lot of promise there, and I look forward to being a part of future conversations on how we can make this happen, again, in a meaningful way that also helps support and move forward the goals of California's Master Plan for Aging. So moving on to the next slide. Wanted to share with you, and hopefully you all have already received a calendar invite to save the date as committee members. I do acknowledge that we have a few new committee members, so we might have to make sure that save the date is also extended to all of you as well. But we're going to be hosting in the fall of this year, specifically on Tuesday, October 8th, 2024, our California for All Ages and Abilities MPA Day of Action. We're looking to host this here in Northern California, Sacramento area, and we're going to be making the registration available to committee members and others in late May, early June. The MPA Day of Action is really an opportunity for us to bring together consumers, aging and disability leaders and providers and policymakers to elevate and discuss the really pressing issues that are facing our priority populations. What I see of this event, it's an incredible opportunity, and it's a key opportunity for us to continue to ensure that California's Master Plan for Aging remains responsive, remains flexible, and also allows us to make adjustments for new information, new resources, and continue that innovation. It really allows us to reflect on our past successes and initiatives and plan for the next set of initiatives and priorities as we move towards achieving the 5 bold goals of California's NPA. Leading up to the Day of Action, we are asking that the various MPA stakeholder committees start to have discussions and conversations about what are the key priority issues and topics and problems that you're seeing in your community related to older adults, people with disabilities, and caregivers. And we're asking that committee members start to think about what are those problems? What are the solutions to such problems? And how do we actually measure, are we making progress on the problems that we're seeing in our communities and throughout the state of California? So I'm kind of doing conversations with various MPA stakeholder committees this spring and moving into the summer, where again, we're going to be looking at walking through a framework where we can understand where are we now? What is the baseline of some of our problems and issues? Where do we want to go? What are some goals and aspirational successes that we would like to see if we were to move forward and advance on a problem, issue, and statement? We're also hoping that committee members will also engage in a brainstorming discussion where they start to think about, well, we've identified a problem and an issue area. We've thought about where do we want to be, our goal statement, but then also engaging in a brainstorm of strategies, interventions, actions that we can take as part of California's Master Plan for Aging to move forward on those identified problem areas. And then we know that there is a lot that has happened to advance California's Master Plan for Aging, but we acknowledge that there's still so much to be done to really improve the systems and the policies to support our priority populations. So we're also asking that committee members across the MPA take their brainstormed ideas and strategies and start to have dialogues about, well, does this recommendation and strategy really line up? Is there a clear direct link between what we're proposing as a priority recommendation to our identified problem? We're also asking that committee members look at, relative to their recommendations, do they center around equity and that lived experience? Do they address priority populations? Are they changing a policy, systems, or environmental change? Are they person-centered and person-led? We heard from Sarah Steenhausen earlier today about the LTSS systems framework. So when we put forth recommendations, are we moving in a direction of one of those 4 pillars: access, navigation, workforce, and financing? We also want to have some conversations about Are the recommendations we're looking to put forth relevant and responsive? Are they timely to the priorities that we're seeing in our communities? And are they measurable? And how do we measure it? How do we communicate the success of moving forward on a particular goal area and recommendation? And then also start to have conversations about, like we just did, what type of resources are needed to actualize this idea, which I think this group was fantastic at when we talked about the Lived Experience Advisory Committee. What we also are asking our MPA stakeholder committee members to do when they put forth their recommendations is to help us think through, well, if we did this recommendation, what are essentially the outputs? What are the direct results that we're going to see for older adults, people with disabilities, and caregivers? And also think about what are the long-term outcomes, even short-term outcomes, intermediate outcomes, and then long-term outcomes, because I think there's a lot of value in being able to articulate how do we measure success and progress on the initiatives that are moving forward. So going on to the next slide, wanted to share with all of you that, again, this really is a day to elevate and focus the future of our MPA initiatives to address the highest priority issues facing Californians. We want to center the future MPA planning and initiatives based on equity and lived experience. So for me, and planning ahead and us having the conversation about the Lived Experience Advisory Committee, this could be a wonderful opportunity to announce the committee or the advisory board or committee or whatever name we come up with at that forum, and allow them to share their stories, or we can also work collectively to brainstorm how that can look like. But it'd be a great way to also announce that group to the state. So we will be gathering priority recommendations from our stakeholder committees at the day of action. If you can advance the slide. We'll also be looking to celebrate the progress that has been made to date, and also renewing our commitments to California's Master Plan for Aging. We're kind of at that mid-year point, and we want to celebrate past successes, but then also reflect on those successes and move forward and progress in making those policy systems and environmental changes. And then the last point I just want to make is, at this event, we are looking to engage diverse partners across our state and also across our nation, inviting state and national leaders, and also our state partners in transportation, housing, social services, developmental disabilities. We're looking, as the Master Plan for Aging is continuing our commitment to doing a whole of government, whole of community approach. And so California, again, continues to lead the way in being a model in how we not only developed our Master Plan for Aging, but how do we continuously implement our master plan to ensure that is informed by various members of our community that have that lived experience, that are consumers of the services and programs and policies. And so just wanted to kind of walk us through what the day is going to look like, a summary like I'm showing here, but also field any questions that you might have. I saw on an earlier slide Marina presented, maybe with some of those priorities, this group might be already thinking of recommendations they want to set forth with regards to having equity embedded into California's Master Plan for Aging. So at this time, I'm more than happy to open the floor to see if you have any questions about the event itself. We are definitely in the early planning stages of not only the agenda, but also working with all of you as valued committee members to put forth the recommendations that will really inform California's Master Plan for Aging initiatives moving into 2025, 2026. Kind of hard to say, but we're here. So let me pause and see if there's any immediate reactions, questions about the event. And I also invite my other CDA colleagues, if you're on the line, to join as well.
I would just say, Jackie, I love the idea of, because this committee is unique in the way that it is focusing its work. And if we are able to together work on standing up a lived experience advisory board, it would be a wonderful opportunity to use that as basically the recommendation of this committee is to integrate the lived experience into the decision-making process. So could be an exciting way to introduce this effort. So I see somebody has their hand raised.
We have a member, and an ECAD
I'm
member,
sorry.
if you can announce your name and go ahead.
Yes, I'm Cheryl Brown, and it's good to see so many people on today. I like the fact that you included the disability community. They are putting together right now, the Department of Developmental Services, I believe it's called. They're putting together a master plan. And I hope that we would be able to actually connect with them, especially first of all, inviting them to the event in September. But some of the same issues that they have are still issues that we have. And I like the fact someone mentioned intergenerational, and I've been talking about that for some time. That's one of the things that I would like to do while I am chair of the Commission on Aging. I love the fact that someone asked about lived experiences. And I mean, that you're talking about lived experiences. I wonder though, how does that look? The last thing I wanted to ask is, are we going to have this event as we did in last year at the convention center? That's it.
Hi, Cheryl. Jackie Tompkins. Happy to answer that last question with regards to the event. And I think you're referencing when we were able to convene the Day of Action in 2022. I think it was in September of 2022 at the Convention Center. And yes, this is going to be a similar event that helps us gather the input and feedback from committee members, as well as others on the priorities and issues that we're seeing to help us shape the next iteration of the MPA initiatives for year 2025, 2026. So the event will have the similar purpose in terms of convening, hearing from our committee members and others, and doing a lot of information and education about the aging and disability issues that we need to address within our state.
Thank you.
And Cheryl, in terms of inviting the Department of Developmental Services, I'm still fairly new, but I think that would be a great idea. And if Jackie and others are on board with that, if there's a point person or individuals that should be considered, we're happy to Yeah,
I was just going to say, Marina, that's perfect because we actually, I mean, the exciting thing about our partnership with the Department of Developmental Services is that we have been working with them on some key initiatives that align with the Master Plan for Aging that deal with the aging of the developmental disabilities population and the needs of the caregivers who are aging as well. So naturally, we will definitely be reaching out to them through that effort to engage in the Day of Action. So thank you, Cheryl, for raising that. And just as an aside, we've also, been talking with our colleagues at the Department of Developmental Services and offering our support however they need it as they build out their own plan.
Thank you. Thank you.
and also Cheryl and Vincent, I did capture your recommendation about having that perspective of intergenerational approach. Thank you. All right. Any other comments? Questions or concerns?
I think, Marina, again, as you and the group move forward with looking at that lived experience advisory committee, we might need to get a shortened name. As Sarah alluded to, that definitely aligns with providing a recommendation to the master plan for aging. So maybe we can kind of have some conversations about how that can look relative to the day of action, and also how it might get incorporated into the initiatives moving forward. So yeah, let's brainstorm that idea a little bit more together. But I think there's a lot of promise and opportunity there.
Great, thank you. Looking forward to that. All right. Well, without further ado, I'm going to turn it over to Carol to see if there's any public comment at this time.
Hello. I will spotlight myself. There we go. Great. Thank you all. So far, it's been a very interactive, informative meeting. So we appreciate all of you, your comments, your participation. Now is time for our public comment period. So for our attendees, if you would like to make a public comment, please press *9 if you're attending by phone, and that will raise your hand. If you're attending by the webinar function, please do your raised hand icon. Do remember that public comment is limited to 2 minutes. So we ask that you respect that so we can get to everybody's comment. And of course, you may always give us comments via our email box at engage@aging.ca.gov. So our first comment is from Jonathan Flint. Jonathan, I think you can unmute your line. Please give it a try.
Yes, can you hear me?
Yes, can. Please go ahead.
Great.
Thank you.
Well, I wanted to share, so I attended the kickoff for the Developmental Services Master Plan yesterday in Sacramento. And two things. Dr. Galley was I think made a point to emphasize that it is a master plan for developmental services as opposed to the Department on Developmental Services. And I think that is a key theme because I think the engagement would be very important and welcomed. And the second is that I would really encourage folks from this group to reach out to Victor Duran, who is from the Department of Rehabilitation and is the director or manager, and share the Lived Experience Advisory Group, because that was a huge theme in the public input yesterday, is really the need for a Lived Experience Advisory Committee, and that really aligned. So I just wanted to give those two comments.
Thank you, Jonathan, very much. Our next public comment comes from Claudia. Claudia, please go ahead. You can unmute yourself.
Yes, hello everyone. My name is Dr. Claudia Tornsöfer. I'm a department chair at a community college, and my department offers non-credit learning opportunities for older adults. And many of the comments that I heard this morning, our learning opportunities kind of align well with the objectives that were and the goals that were addressed today. I belong to a network of educators in the community college system. So there are 115 community colleges. Most of them do offer these special learning opportunities that are designed for seniors in the state of California. And it ranges from law and retiree, how to well, we have so many classes, it's kind of difficult to summarize them all, but it's also to access really the resources that are available, how to navigate effective communications through technology. So these are kind of vital skills that our students learn in these classes, and to navigate a modern life as people age in the state of California. So myself and members of this network, we would love to connect with the Department of Aging, because kind of our objectives and goals do align. We have the same really best interest of seniors in our state in mind. So I just would like to offer our participation in advisory committees and to connect more the local departments to the California Department of Aging.
Thank you, Claudia. Deborah Roberson, your hand is up. Please go ahead.
My question is,
you have a bit of background feed. I'm sorry. I'm not sure what. How about now?
okay, I don't know what that is.
Yes, I'm sorry, Deborah. I'm sorry, Deborah.
I emailed my question.
You did email your question to Engage?
Yes, it was concerning what are you doing with the African American outreach? I find a lot of African Americans have no knowledge of the agency in general, and then of course the master plan. So my concern is with other cultures, etc., which is great, which is needed, language, you know, interpreters, etc. Where is the solid outreach? So all underserved communities will be engaged with the plan in general, and then of course the events. The second question is, how does one join? What is the criteria, or where can I access that information in reference to joining the advisory committee? Thank you.
Thank you, Deborah. I'm glad we figured that out. Perfect. Thank you. Okay, have we any other public comments? Let me stop the watch. Any other public comments? Thank you so much. We really appreciate it. And again, thank you to those who did email Engage to provide more context. And of course, you're always welcome to email Engage, ENGAGE at aging.ca.gov. If we have no more comments, we can move it back to Marina to close us out.
All right. Well, thank you. First and foremost, I want to thank our public for joining us and hearing your comments. So Jonathan, I wrote down Victor Duran's name, and I'd be happy to reach out and talk more about this concept and proposal of the lived experience. So thank you for that. And Dr. Claudia, I will put my information in the chat as well. So I'd be happy to connect with you to learn more about the adult network that you belong to of educators, and just to learn more from each other. Also, Deborah, please provide your information. It would be great to do a meet and greet and talk to you more about outreach to the African American community, and how you can become involved in our committee. So happy to connect with you as well. Cheryl, I see your hand raised. Do you have a comment, or is that from the past?
There we go. No, I was trying to get the information from the person who is at the community college. That's one of our goals, is to get um, the aging um, the aging community involved in in education, K through 14. So we're working on that, and that's one of our goals of the California Commission on Aging, and she would be perfect for that. And when it comes to the African American community, I hear exactly what the caller said. We do have to do more because there is very that's a area that is important and has not been covered like it should be. And I can't do it myself, so.
Thank you,
Thank you.
Cheryl. I would be happy to, when I arrange the call with Dr. Claudia, to invite you to that. And also, not too long ago, I met with Julia, who is a real expert in communications and messaging. So perhaps we can all jump on a call together.
That would be, that would.
Great. Thank you. So there were a few follow-ups that I just wanted to mention before we end our call today. One is that I heard just some recommendations for the LGBTQIA+ study moving forward in terms of a recommendation for a focus group with older adults with HIV. And also just that consideration still of the urban and rural areas and the differences in outreach, engaging, and getting their perspective based on their needs for accessing services. Vincent also mentioned an upcoming webinar in May. Vincent, if you want to share that with me, we could share that broadly. So I'm happy to do that. I've also heard a resounding support for the proposal of the Aging and Disability Lived Experience Advisory Body. There are some next steps in terms of, you know, what Sarah spoke of, exploring and investigating resources to support this proposal. I also really appreciated the comment by Alvira, who mentioned, you know, the sustainability piece of it. How do we support, you know, those representatives with, you know, just having the basic access, computer and otherwise to be able to participate. We also heard about the importance of inviting lawmakers to either participate in this panel or be able to listen and learn and grow their awareness regarding these issues. We also heard about the importance of having representation from a intergenerational perspective and a perspective of intersectionality mapping. That would be key. We also heard that it is important to really, people don't want to do this for free, that we should honor and to some degree compensate them for their time. And what that would look like. We also heard about the importance of, if we gather this information and take recommendations and feedback, how then do we integrate that and demonstrate to community that we're listening and creating impact and seeing their recommendations embedded in the work that we're doing. And so I also just put a call to action regarding some committee members who would be interested in helping me kind of devise what this would look like. And so thank you for those who reached out in chat. I'll be reaching out to you, me or my staff, to have an initial meeting after I meet with my leadership and just get a little bit more of the framing for this. I want to see, just turn to Sarah or any of my team to see if I missed any other pertinent information that was shared with you today. Thank you for your participation. I appreciate the robust discussion, and I look forward to working with each of you more on a smaller scale. And so as soon as we get a little bit more ideas about the priority areas, we are really talking about work groups or subcommittees in between our meetings to keep this good work happening. So, and then the last item was that I will reach out to the smaller group with Cheryl and Dr. Claudia and Julia to have some initial conversation. Anything else?
I think you covered it. And, I'm really excited about today's conversation and for everybody's engagement. And I think that what's exciting is we could really start thinking about, focusing this committee's work on this lived experience advisory board. So that really could be where the work happens, and standing it up and then helping guide the direction of that work. So we'll be, as Marina said, in touch with next steps, and we'll be doing some of our own kind of information gathering, and then we'll look to you all and whoever wants to be part of that kind of process in between now and the next meeting. Appreciate those who have expressed interest. So just a big thank you to you all, and to Marina, of course, for pulling together this meeting and leading such a thoughtful discussion.
Thank you all. Have a great day.
Bye-bye.
Bye.
Thank you.
Thank you.